Welcome to the Great Places People podcast, and today's podcast is in aid of National Bowel Cancer Awareness Month. And here with me, joining me today, is Gazzala from Answer Cancer. So welcome.
Thank you. Good morning.
So we've just got a series of questions to ask around the subject of bowel cancer. So just to kick us off, what is Answer Cancer?
Okay, so Answer Cancer is the Greater Manchester Cancer Screening Programme, which looks at raising awareness of cancer screening in Greater Manchester so that we can increase the uptake of cancer screening programmes. So we have 3 screening programmes: bowel, breast and cervical cancer screening.
Fabulous. So obviously you mentioned you've got 3 cancer screenings that you focus on.
Mm-hmm.
What is the reason for having bowel as one of the 3 that you focus on?
Okay, so because within the NHS there are 3 screening programmes for which you're invited, so we focus on those 3 NHS programmes, and bowel cancer screening is almost like the 4th greatest cause of deaths of cancer in the UK. So obviously it's a really important cancer for us to focus on. Because it's all about that early detection could potentially save lives.
Yeah, of course.
Yeah.
And so what are the most common early warning signs that people need to be aware of when you're thinking about bowel cancer?
Okay, so there's a number of signs that we look out for. So what we always recommend is for individuals that if they notice any change in their bowel habits, which has been ongoing for 3 to 4 weeks, is to basically get it checked with your GP. So the main things that you'd be sort of looking for in terms of changes are any signs of blood in your poo that you notice yourself, a change in bowel habits, excuse me, a change in bowel habits. So that's also means understanding and knowing what your normal bowel habits are. And everybody's bowel habits are very different. You know, for some people they might be going to the toilet twice a day. For some people it might be 2 or 3 times a week. So it's just about knowing what your normal bowel habits are. And if you notice a change which has lasted for more than 3 to 4 weeks, then we definitely recommend that you go and see your GP. Also, any problems in terms of bloating, tummy ache, any lumps or bumps that you might notice as well, an increase in tiredness for no specific reason, loss of weight as well, again for no specific reason. You might be eating healthier, going to the gym, etc. So that's a reason why you'd be losing weight possibly. But if you've not made any changes and you're noticing that weight drop, and you might notice it in somebody else, a family member,
of course.
So it's really important to sort of look out for these things. So they're the main sort of symptoms that you should be sort of looking out for. And if you have noticed any of those things, then definitely the first thing for you to do would be to contact your GP. And then obviously we have what is known as the bowel cancer screening programme. So that begins from the age of 50 at the moment in the UK. So
which is just recently reduced.
It's just recently been reduced. So formerly it was between the age of 60 to 74. Recently they're bringing the age down to 50. Now it's not quite got to 50 in all areas across the UK. However, in parts of Greater Manchester, they are at 50. And we know that in Manchester, hopefully by the end of sort of March, April, year end, we should be down to 50. So what that means is that when you turn 50, you will receive what is known as the bowel cancer screening kit in the post. And what is required is for you to complete this test kit at home. And what we want is a sample of your poo. And what that kit is basically looking at, what that test is looking at, is to see if there are any signs of blood in your poo, which could be an early indicator of bowel cancer. If it comes back positive, it doesn't mean you have bowel cancer. It simply means that they've detected blood in the poo, and then it's something that requires further investigation. So I've got a bowel screening kit here. So this is what would normally arrive in the post, preferably in better condition than this one. And then what's included in here is a prepaid envelope. And then you've got the kit itself, which is this. So again, like I said, what's required is a sample of your poo.
Yeah.
So what we recommend is that you get maybe an old plastic tub, pop some toilet tissue into the tub and pop it into the toilet. You do your business, and then you can quite easily get your sample. And what's required, it's got tiny grooves on here. We just need those grooves to be covered. Not too much either, and you can see there's a tiny hole here. So just enough that it's going to get through there. You take your sample, pop it into here, and then your toilet tissue and your poo can go into the toilet, flushed away, and you can dispose of the tub. I think that's quite an easy way to do it, really.
Yeah, definitely.
And then this would then go back in your prepaid envelope, and you'd pop it in the post, and your post person would know no different of what's in there. And that would go in the post, and then normally you would receive your results within about 2 weeks. Yeah, and often enough it'll come back, negative. But what we're trying to capture is those few people where it is positive, and then, like I said, then further investigations would be undertaken. You'd be invited back to see your GP or your a specialist nurse, who would then talk about the options of the way forward, really.
So you were saying those are sent out to male and female that are
male
50
and
over.
female from the age of 50 to 74. So for example, like I said, in Greater Manchester, we're not quite at 50 everywhere. So for example, if you're sort of 51, let's say, for example, you would wait now until you're 52 because it comes every 2 years. So for example, I'm 51, and because I've sort of missed that window of receiving it at the age of 50, I will now receive it when I'm 52. But anybody that will turn 50 should receive it in the post, and then it goes up to the age of 74 when you'll automatically be receiving it. However, at 74 you will stop receiving it automatically. However, you can call the bowel screening program number, and you can request to continue to receive it. And then they'll send it out to you again every 2 years, but that is only on request.
Right, okay.
Yeah.
So for anyone who might be, thinking of wanting to get tested, but are not at the age of 50, 52, perhaps a lot earlier than that, younger than that, what would you advise them to do? Okay,
so for anybody that's got any concerns, because naturally you'd probably be concerned about something, and that's why you might want to get tested early, the recommendation is always to contact your GP with whatever concerns you have, and get yourself checked out through the GP symptomatic route. So if you are experiencing any of the symptoms that we've mentioned, or you have any concerns, you would just contact your GP and get yourself checked out that way. And we always do recommend that you know your body best, and you would know if something's not quite right. And we do encourage people to be body aware, to keep possibly like a health diary as well, and that's always really helpful if you do make a GP appointment and you go to see your GP, because then you're able to present actually what your symptoms are and how often they've been occurring and when they've started, etc. So we do always recommend that people try to keep some sort of a health diary as well. But again, if you're noticing any of the symptoms, the advice is always get it checked from your GP, and don't wait for your screening kit. Or same goes for any of the other sort of cancers as well, is that if you notice any symptoms and you're concerned about something, get yourself checked out.
Great. And what's good about this partnership with Answer Cancer is that we are part of the Get Screened, Get Checked.
Be seen, get screened. Yes.
Thank you. Be seen,
okay.
get screened.
Yeah.
And that what that means is that allows colleagues to be able to make an appointment during working hours, if need be, in order to get that check done and to be able to have it as quick as possible.
Yeah,
really.
Absolutely. I mean, it's a fantastic initiative. Be seen, get screened, and what it means is that great places have signed up to our pledge, which allows staff where they can't get appointments outside of work hours to be able to take some time from work, and also you're working with us to raise awareness about cancer screening, which is fantastic. We've got over 100 companies signed up to the pledge, of which yourselves are one. So we're really pleased to have you on board.
Fab. And do you have any statistics around bowel cancer, especially perhaps compared to the UK, to Greater Manchester, because I know there's quite an emphasis in the Greater Manchester area.
Yes, absolutely, yeah. So, although there's been a lot of effort to try and get the rates of people participating in the bowel cancer screening, unfortunately, we are lower than the national average. So in Greater Manchester, the uptake is around about average 56%, whereas the UK average is around about 69%. So we have got pockets in Greater Manchester where we are meeting the national average. However, we have got lots of pockets as well where we are not achieving those. So we Answer Cancer is one of the programmes which is working to try to work in those areas to try to increase that uptake. We're also working quite closely with the Manchester Local Care Organisation, who are again doing specific targeted work with various communities to try to increase that uptake and raise awareness of the importance of sending back the test when people receive it, and not just putting it to that side and ignoring it.
And do you know what the reasons may be, some of the reasons that perhaps people don't participate in the screening process?
Yeah, absolutely. So there's numerous reasons. They could be sort of like cultural reasons, faith reasons, and also sometimes it's just down to sheer sort of laziness and forgetfulness as well. Often I speak to people and they'll say, oh yeah, I had that, it's been sat on the mantelpiece for so long, and they just need that nudge and that reminder. So it could be various reasons, and where it's sort of culturally based, we can talk with communities, we work with local people to get them on board as champions, so that they can sort of share those messages, advocate in their own communities. So it's building that trust with various communities really, and encouraging people and understanding where everybody's coming from as well, and just trying to slowly encourage people to try to participate and look at the benefits of actually participating, and trying to sort of allay people's fears as well. There's another one of the reasons why people don't sort of participate and send it back is the fear of what they might find out. So again, we talk about certain ailments like diabetes, blood pressure quite openly. And we're always quite happy to go to the GP to speak about it or take the medication once we've been told what it is. We understand that these ailments are treatable. So what we want to try to encourage people to do is to think about cancer in a similar way, to talk about it more openly, and to understand that, if we can detect cancers early, often enough they can be sort of treated and preventable as well in certain cases as well. So it's about having that conversation with individuals, and making it part of your routine really, and getting that check done, because the NHS cancer screening programs are for what we know as healthy people. It's people who haven't come forward with symptoms. It's about looking at the general population and just getting everybody checked, just so we can get that early detection. And I think I heard on a different from a different colleague that the checks is not necessarily like you say before, looking for cancer, it's looking for blood. That's right,
it?
Yes.
So if it's a positive, it doesn't automatically mean that it's cancer. It's just, it warrants another check on top.
That's it. So we want to kind of make people feel a little bit comfortable in the fact that, if it is, if it does come back positive, we don't want people getting into a panic and assuming, the worst. What it is that it could be for numerous other reasons. It's just about trying to rule out whether it is. And again, like other cancers as well, if it is positive because they've detected bowel cancer, there are so many treatments. Science and medicine is so advanced now, lots of treatments available, and treatments tend to work better when it's detected early as well. So the idea is if it's there, let's try to detect it early when the chances of treatment are going to be better and higher. Yeah.
And I imagine some of the reasons perhaps that people don't do the test is because it can be quite an embarrassing situation, isn't it? But this test does seem to be it's private, isn't it?
Yes, absolutely. So
taking that embarrassment away, isn't it?
Yeah, so it's a slightly less intrusive test, and we understand that, if it does come back positive, you may well be invited for a colonoscopy. Which is, again, a little bit more intrusive, and, people might feel embarrassed. But again, what we like to encourage people to do is that, it would be far better to have that little bit of an intrusion and, that discomfort than to, get to a later stage of having bowel cancer and then undergo far more intrusive treatments, etc. as well. So that's how we can try to encourage people and try to overlook the embarrassment aspect of it and look at the benefits of for you potentially. Yeah,
definitely.
Yeah.
And is there any particular group of people who would be considered at high risk of this type of
so we know
cancer?
that with various cancers, bowel cancer is one of them, that as you get older and you're over the age of 50, your risk increases. So what we do like to also recommend is for people to sort of look after their health as well. So things that we know that can sort of prevent the onset of getting bowel cancer or decrease your risk is by, having a healthy diet, reducing the amount of red meat that you're eating, trying to have a lot more fibre, so you've got good bowel movement going on, reducing the amount of alcohol you're drinking, if you're smoking, trying to quit smoking as well, because we know some of these things are increase your risk of getting bowel cancer. So it's, again, looking at your health as a whole and trying to reduce your risk of getting it in the first place, and by eating a healthy diet full of fruit and fibre and vegetables, etc. A healthy diet, exercise as well, increasing your exercise. And what, that will help, with
Lots
risk
of
factors
things.
of other health ailments as well. So
Fabulous. Well, I think I may have covered all my questions. There's any other bits that you'd like to raise that may not have asked?
No, I think all we would like to say is that, we just like to encourage people to, take control of your own health. And we know it's not always easy, getting a GP appointment. But again, if you do notice any of the signs and symptoms, do be persistent. Do get yourself checked from a GP, don't wait. It can be hard making that first phone call and getting through to your practice. We know it's not always easy. And like you said earlier on, there is a little bit of a sense of embarrassment. There can be as well. But try to sort of, take control of your health and be persistent and get yourself checked out. Like we said earlier, detection can save lives. And when you do receive the kit, just do it routinely, and don't think that if you've got it sort of, because 2 years can go past quite quickly, and you can also become sort of almost complacent that, well, I did it 2 years ago, everything was fine, I'm fine. Be regular with it. Every 2 years, send it back, because like with any cancer, they can begin to spread quite quickly, some cancers in some cases. That's why we have that regularity of every 2 years.
Great. Thank you.
You're welcome.
Well, I hope you found this session informative, and that you spread the word with friends and family.
Absolutely.
It's about raising the awareness, so you might not feel it's directly for yourself at the moment, but do spread it and talk about it with friends and family. Wonderful. Thank you.
Thank you.